Welcome to VAA Global, and this is our medical virtual assistance course. In this course, we are going to introduce you to what it is, how you can become an MVA, where can MVAs work, what do you need to learn MVA, right? And of course, the different lessons inside it. And we're also going to do medical coding today. So you are going to learn how to look up codes and how to get started as MVA. So after this free video, you can decide to now go for the paid course or not. It's optional for you, okay? So now, why VA Global? VA Global is accredited by the Skill Development Council Canada, and our certificate is recognized in more than 150 countries globally. All right, so you can also verify our certificate by yourself. Go to this link on your screen and use this code as your verification code. All right. There, of course, we have our track record of over 1,000 graduates, 14 graduates, over 400 who are already placed in different jobs. All right. You get a reference and matric number immediately you become a student. And of course, we do not promise, even though all of these things are happening, students are getting jobs, we still do not promise jobs. It is against our policy to promise job. So, what is a medical virtual assistant? Medical virtual assistant is a remote professional who handles the administrative side of healthcare for doctors, for clinics, for telehealth companies without ever stepping physically into the building. So you're going to be working from home virtually. All right, you're going to manage patients, you're doing appointments, calendar management, you're going to handle patient intake forms and documentation, you're going to work inside the EHR systems, of course, insurance verification, and of course, support billing basics, support telemedicine sessions and follow-ups. All right. So those are the things you do as MVA. That is how the different job descriptions you are going to be seeing in MVA look like. Okay. Now, how can you become an MVA? You don't need a medical degree. You don't, I did chemistry in school. You don't need to do nursing. You don't need to be a medical doctor as long as you learn very well. So complete beginners can learn, all right? Career changers can learn, all right? Nurses, of course, you can learn. Stay-at-home parents can learn, all right? And other professionals can learn as well, like customer service admin professionals can also learn MVA. So where can MVAs work? Private clinics and solo practitioners in the US, UK, and Canada, therapy and mental health practices, telehealth and virtual care companies, medical billing and medical administration agencies, then of course small hospital groups like your PCs, your primary care clinics, hospitals, you can also work in those areas as well. So what do you need to learn? So you need to undergo detailed teaching across these modules. You need to learn what medical terminologies, healthcare systems, patient communication, HIPAA compliance, detailed HIPAA compliance, appointment scheduling, patient intake forms, documentation, insurance verification, EHR systems like Open EMR, right? Then, of course, you need to learn how to market yourself. So learn medical coding, medical billing, telemedicine support, documentation, case management, client attention, and how you can scale your brand. So those are the different things you need to learn, and these are the things you are going to be learning in the MVA course with VA Global. All right, these are the things you're going to be learning in the MVA course with VA Global. Now, let's quickly look into one of the different interesting areas in MVA, and that is what we are going to do for this particular video. So you want to do medical coding. Now, in medical coding, there are different codes across different compliance, all right, different regulations, different bodies. So we have different regulatory bodies in healthcare systems. All right. Now we are going to be looking at one of the different codes. So let's use CPT code for example. So we're going to look at how to look up a CPT code right now. How to look up a CPT code. Now, the first thing you want to do when you're looking up a CPT code is to read the operative report. All right. Look at the exact procedure performed, not just the general time. Then identify if there are any anatomical site or approach used. There are going to be some okay, all of these things are going to be new to you because you don't have any experience yet, and that is why you need to go for the course. So when you come, we're going to teach you what all of these things mean. But for today, we're going to do medical coding. Just watch, okay? So now you're going to watch whether they are laparoscopic or whether it was thoracic or cervical or whatever. Then you look for different qualifiers, okay? So qualifiers are things that give extra detailed about what was done. So CPT code generally are codes that used to represent what the provider, the doctor or the provider does to the patient or on behalf of the patient. Okay, they are the codes used to represent what the provider do or does to the patient or on behalf of what the patient. So once you know that this CPT code talks about operational, surgical, um different surgical things, you understand, operations. Since we are talking about what the doctor does to the patient or on behalf of the patient. Okay. Now, once you know once you get the exact procedure that was done, you read the detail, you read the notes, and that's going to help you to look up your code. Okay. Now, the next step is to look up the procedure by its main time in the CPT index. Now, the code book has what is called index, which is usually at the back of the book. So when you go there, you look up the exact time, the exact medical term that was done. It could be something like esophagotomy, appendectomy, anesthesia. All right, it could be different terms. So you look for it in the index, like we're going to do very soon. Okay. So once you've seen the particular term, you look for the exact description that was done. Okay, look at it, identify the anatomical site and approach that was used. Okay, now we know that it is what? Esophagotomy, for example. Now, this esophagotomy, was it cervical? Was it this? Was it that? You must look at the approach that was used because one single operation could have different other things. You understand? A doctor could do appendectomy and not do it not use a particular style for it, a particular approach for it. So you must know which approach was used. Now, why do you even need to do medical coding? This is what you will use to, give claims. This is what they will use and pay your clinic, pay the clinic you are working with on behalf of the patient. The insurance company that covered your patient, that is what they will use and pay. So without proper medical coding, a lot of things are going to be missed out. All right. So let me off my video so that you can focus on the lesson properly. Okay. So let me just off my video. Okay. So now, then once you found the main time, like appendectomy in the index, right? I said you go to the color pages, the color chapters to go and look. Now inside your coding book, the code are divided into different sections, majorly 6 sections. We have what is called the E and M, that is evaluation and management section. We have what is called anesthesia section. We have the surgery, the radiology, the pathology and laboratory, and the medicine. So these sections are what you go for when you want to look up the code inside the color pages of the coding book. All right. Then you now match the code exact description from what the doctor has given you or what has been given to you, all right, against the operative note that you have using that particular chapter. You understand? So this is just theory. Let's go to the practical now. To look at this scenario. So we're going to follow all of this procedure now to look up this question. This is what esophageal foreign body. A surgeon performs an incision into the neck portion of the esophagus to clear a swallowed foreign body. The operative report confirms a cervical approach was used. No other procedures are noted. Now, this is the answer, right? But how do we get this answer? So let's go and do it. Let's go and see if we're able to get the answer. Okay. Now, what was done? A surgeon performs an incision into the neck portion of the esophagus. So it has to do with esophagus, right? So we're going to copy that part of the body, which is the esophagus, and we'll go into our code lookup. So you can use this aapc.com to look up your code. So I'm going to paste that esophagus here. esophagus. So look at it. These are the answers from esophagus under codes. But we can't know which one is the answer right now. There are different codes here, you understand? We can't choose which one is our answer. So until we go back to the question and say, okay, so what exactly do we need there? Look at it. To clear a swallowed body, he performed an incision to clear a foreign body. So now let's go back. So let me close this. Okay, so look at it. So we have under esophagus, we have ablation, lesion, acid perfusion, biopsy, right? Cricopharyngeal diagnostic, dilation, endoscopy, excision, imaging, incision. You can see which is what we want because they said what he performed an incision. Now under incision, you can see muscle, cricopharyngeal, and of course we can see with removal of foreign body. So look at what we want. Removal of foreign body. Look at it. So we're going to go to that foreign body. So we have two codes, 43020, 43045. So we don't know which one is the answer, okay? So we'll go into each of them, which are the color pages, okay, to look into the full picture of that code. So in this one, the provider makes an incision into the neck to reach the esophagus for removal of a foreign body. So that's exactly the code we are looking for, okay? Now, but we have two options, but let's go back and confirm why this was not our answer, okay? Why this was not our answer. Let's look at it. To look at this, 43045, the provider makes an incision into the thorax or chest to reach the esophagus for removal of a foreign body. So this is what thorax or chest. So even though both of them, you can see both of them are what foreign body, but this one was what? Let's look at it again. This one was what? Neck. Because the question says the neck portion of the body, the neck portion. All right. So it's not thorax. Let's look at it again. So this one, the provider makes an incision into the neck to reach the esophagus. So this is the exact answer we are looking for. You can see 4303 is the answer. So these are just CPT codes, okay? When you come for the course, we're going to teach you how to do the different steps you can follow to look up codes and do medical coding very well. Of course, this is what you need as medical virtual assistant. So in our medical virtual assistance course, you're not going to learn just medical coding. You're going to learn appointment scheduling. So let's go back and look at everything you're learning. You're going to learn healthcare systems, patient communication, HIPAA compliance, appointment scheduling, patient intake forms, documentation, insurance verification. You can see EHR systems, video conference, CRM tools, data security, of course, how to market yourself, to get clients, how to get jobs, right? Medical coding, medical billing, telemedicine, a lot that you're going to be learning, okay? A lot that you're going to be learning. So let's get another example. This is open appendectomy. Open appendectomy. So what happened here? An operative report details an open appendectomy performed on an intact non-ruptured appendix. So look at it, intact non-ruptured appendix. No other procedures or surgical complications are documented. An operative report details an open appendectomy performed on an intact non-ruptured appendix. No other procedures or surgical complications are documented. So what's our answer? Let's go and do it. So what was done? Appendectomy. So let's close on all of these other guys. So I'm going to paste the appendectomy here. So in appendectomy, these are the different codes we have. Of course, we are doing CPT, not ICD, okay? Now, we have 1, 2, 3, 4 codes, but we don't know which one is the answer. So we have to quickly check what they mean, okay? What the different codes mean in the color chapters to see which one aligns with what we are looking for. So this one, the provider removes an inflamed appendix, a sac-like structure situated in the right lower quadrant of the abdomen at the junction of the large and small intestine. It performs the procedure to relieve pain and to prevent infection or rupture. That looks so much like what we are looking for. Okay, but we can't say right now that is the answer until we check other options. Okay, so let's look at the second one. So it's loading. Let's load. So look at it. The provider removes appendix sac-like structure. Okay, it removes appendix to relieve pain because it shows evidence of active inflation. But this is saying that no inflation. Remember, no. Look at it. Non-ruptured. Because non-ruptured appendix. So this one it's unintact. It's not ruptured. And no other things were done. No other surgical complications. You can see no surgical complications, no other procedures were seen. But in this one, there's complication, you understand? So let's look at the next one. 44960. 44960. So this one, it removed the rupture, right? What happened? It performs the procedure because of abscess formation or widespread peritonitis, inflammation in the peritoneum to prevent further complications. All right. It performs the procedure because of abscess formation or widespread peritonitis. So this looks like what we are doing, but this one is ruptured. Ruptured. But the question says what? Non-ruptured. Non-ruptured. All right. So if it was ruptured, well, this would have been our answer 44960. But the question said non-ruptured. So that means we stay with the first code, which is the exact thing that we are looking for right now, which is 44950. 44950. Okay. So you see that it's not hard at all. So I want you to try this. What's your answer? Try this. Okay. Drop your answer in the comment section on this website. Drop your answer. Let's see who will get it. Okay, so the anesthesia provider is providing anesthesia services for a patient undergoing the removal of the prostate and some of the surrounding tissue. Okay, so I know that. So the answer is already on your screen. 00865. So let's do it since it's already on your screen. I wanted you to do it before, but I just realized that it's already on your notes. So we'll go forward. Go for the keyword, which is this. All right, prostatectomy. So we'll paste it here. Prostatectomy. Okay, so you can see that's the keyword. Then what was done? What was done? Let's go back. It did what? Anesthesia services for a patient undergoing removal of the prostate. So let's look at these are all what ICD codes. This is not what we are looking at. Okay, we are looking at CPT code. So let's look at 00865, which is of course is the answer, like you have seen. So look at it. The provider performs anesthesia services for a patient undergoing removal of the prostate and some of the surrounding tissue. So that quickly gives away the answer. Okay, because that is exactly what he did. So you can see now these are some of the tools and software you will use. OpenEMR, because that is the one you will use. When you learn HIPAA compliance, you will learn why some of those tools cannot be open for you. So you need to use an open source like OpenEMR. Then I'm going to learn video conferencing tools, CRM tools, scheduling tools, HIPAA compliance. Okay. So what do you need? If you have a laptop, fine. But like we always say to our students, if all you have right now is your smartphone, apply, all right, and practice with your phone till you can afford a laptop. Of course, you have to be able to speak English, right? Then, of course, you have to be willing to learn, and you don't need any medical or any background. Okay, so how much can you earn based on experiences from our students and what they've been able to achieve? So payment varies per the clinic and who is hiring you. Okay, and payment is usually in US dollars, British pounds, or Canadian dollars. So you can, of course, you can do your personal research per level because there's entry level, there's more senior level. So you can try and see how much exactly you can, but the payment varies. Okay. Now, when you start working remotely as MVA, you need to understand the time zones. So if you're in Nigeria, your 9 o'clock here is 4 a.m. in US Eastern, right, which is also 9 a.m. in UK and 4 a.m. in Canada. So just try and do your research about the different timing to see the time zone differences. Okay. Now, every graduate finishes with an SDS Canada endorsed certificate, which of course it's one of the criteria we use for our talent placement. So, like I've told you before, we place our students for jobs, all right, but you need to get a certificate from us. So, what happens after you graduate? You're going to be listed on our talent management platform. You're going to have your 2 months remote internship. So, we have people ask us questions: do we pay students for this internship? It is unpaid, it's for experience building. Then you get job assistance and interview coaching, portfolio building and LinkedIn optimization. And of course, we're going to give you access to our remote that has over 100,000 remote job listings. So some of the things you get from VA Global. All right. So do well, watch this video again, understand what MVA is over again. And when you make up your mind to enroll, click the apply button below, right, and go ahead and complete your registration. Of course, on the registration page, you see options to pay once, twice, or 3 times. Choose anyone that is convenient for you. Enroll and start learning with VA Global.